Hey guys, this is Dr. James Kim. Sorry about the noise. I'm actually in a cafe to do this Facebook Live. So I haven't got any questions, but I'd like to share with you some of the tips that I have regarding the panic attacks. So in the Stone Age, our uh, ancestors always stressed protecting the body from the wild beasts. Fortunately, I don't think you have to run away from the wild beasts all the time. Thus, the stress for facing wild beasts can be less. But what about modern people? From the moment we open our eyes up from the moment and until we go to bed, we are stressed out all the time, as we know. Therefore, there are many stress-related diseases. Stress can also cause stress-related gastritis. Symptoms include indigestion after ingestion of food, pain at the tip of the stomach, discomfort, bloating, and acid reflux symptoms. Stress has a great physiological, psychological impact along with digestive system diseases such as gastritis. Let's take a look at some of these stress-related panic disorder. You may have heard of panic disorder and panic attacks, but what is the difference between the two? Panic disorder is characterized by recurrent unexpected panic attacks. In addition, it is a disorder that adversely affects daily life because there is a fear that symptoms will appear even when there are no symptoms. Panic attacks are accompanied by various physical symptoms, such as chest palpitations and dizziness, despite the absence of any external threat. It is a symptom of intense anxiety and fear. A panic attack occurs with four or more of the following 13 symptoms, along with a feeling of intense fear or discomfort. First, palpitation, a feeling of pounding heart or rapid pulse. Second, sweaty hands. Third, shaking hands or feet. Fourth, feeling short of breath or choking. Fifth, feeling like suffocating. Sixth, pain or discomfort in the chest area. Seventh, nausea or stomach discomfort. Eighth, feeling dizzy, staggering, or vomiting. Ninth, a sense of unreality or a sense of alienation. It's a strange feeling as if the world has changed or a feeling that you have changed. 9. Fear of losing control or going crazy. 10. Fear of death. 11. Strange sensations like tingling and numbness in the knees. 12. Chills or a burning sensation. So, okay, then let's find out what causes panic attacks. The causes can be remarkably diverse. Genetic predisposition and social learning may be the cause. Food allergies can also cause a variety of anxiety and panic attacks, both mild and severe. Panic disorder can also occur when lactate or lactic acid uh, enters the bloodstream. In two-thirds of panic disorder patients, intravenous sodium lactate was administered, and at this time, it was confirmed that panic attack occurred to those patients. Additionally, high lactate blood levels were found in patients with anxiety. So, as we know, lactate can cause panic attacks. Certain medications also can cause panic attacks. Panic attacks occurred when the patient took the alpha-2 adrenergic antagonists called some of the medication is Yohambine and also inhaled carbon dioxide. Panic attacks can occur when there is problem with the functioning of the autonomic nervous system. So first, let's talk about norepinephrine. You've heard about this neurotransmitter called norepinephrine. It is neurotransmitter secreted by the sympathetic nerve, and the core governing the noradrenergic system is located in the locus coeruleus of the pons. In an experiment of primates, it was confirmed that a fear response appeared when this locus was stimulated. And when this site was removed, it was confirmed that the complete blocking of the ability to form a fear response was inhibited. Isoproterenol is a one of the type of beta-adrenergic receptor agonists, or yohimbine as an alpha-2 adrenergic receptor antagonist may cause panic attacks. In contrast, alpha-2 adrenergic receptor agonists such as clonidine have been shown to reduce anxiety symptoms. Second, let's talk more about the serotonin. So, as we know, serotonin is known as a happy hormone. Antidepressants can actually increase serotonin, which often used in drug treatment for anxiety disorders have been found to be effective in some anxiety disorders. Third, let's learn about GABA. Uh, Benzodiazepines can act on GABA A receptors, and what it does is that this drug can play a very important role in treating anxiety symptoms by increasing the activity of GABA. Some of you may have heard benzodiazepine and low potency benzodiazepines can also be very effective for most anxiety symptoms. Drugs such as alprazolam, it's a member of the high potency benzodiazepines, are have been found to be very more effective for panic disorders. For reference, if we compare low tier and high tier drugs to alcohol, low tier drugs can correspond to beer, you know, with having low alcohol levels, and high tier drugs to liquor or alcohol with very high alcohol levels, such as rums. Fourth, let's talk about alcohol. So we all know that alcohol is, can make us, feel very good. However, it can also give a very reasonable uh, symptoms that's very related to panic attacks. So phobias and panic disorders are often found in patients with alcohol dependence on anxiety disorders. When alcohol is consumed, our body is experiencing relaxation and anxiety reduction can affect. However, when you wake up from alcohol, you may experience stronger fear and uncomfortable physical symptoms. Alcohol can interfere with recovery from panic disorder. If you drink alcohol, your panic disorders or symptoms may be relieved, or you may experience the feeling of getting better. So in this case, you should suspect alcohol abuse or dependence. Fifth, so let's talk about caffeine. So we all love caffeine, um, but some studies show that depressed adolescents consume 4 times more, I say 4 times more, caffeine as healthy adolescents. So when patients with panic disorder were injected with 480 milligrams of caffeine, which is equivalent to 3 cups of coffee, it's a 60% of them had seizures. 60%. People who consume caffeine frequently and in large amounts may experience hyperhidrosis, heart palpitation, and tinnitus, and these symptoms can lead to panic attacks in the future. Therefore, patients with panic disorders should try to reduce their caffeine intake as much as possible. And it can include tea or coffee, as we know. Next, let's talk about fructose and some type of those liquid type of fructose. In these days, modern people consume lots of carbohydrates than we know, and those carbohydrates can be consumed very easily. So when we think about carbohydrates, we often think about glucose, right? However, there are very different types of carbohydrates. There are good types of carbohydrates and there are bad types of carbohydrates. And what I meant is that fructose or liquid type fructose in beverages, especially such as in soft drinks, they can increase the blood sugar level in your body very rapidly, and also your blood sugar level in your body can plummet very drastically. And what it does is that your body is required lots of food right after your ingestion because you're feeling this roller coaster of energy. So in this way, you experience this blood sugar roller coaster in which your blood sugar rises and falls very easily. This blood sugar roller coaster further increases emotional changes and anxiety. So let's talk about vitamin B group deficiency. Vitamin B12 deficiency can lead to anxiety, depression, and panic disorder. B vitamins such as B6, B9, B12 are essential for the proper functioning of the nervous system. It helps people to calm nerves and reduce mental stress and fatigue. So B vitamins are found a lot in quantity such as in liver, meat, turkey, whole grains, and banana. In particular, the vitamin B groups decrease rapidly in the body when you are undergoing very in stress levels, such as in anxiety and depression patients. Therefore, it is very necessary to supplement the B vitamins through supplements in addition to food that you are intaking. Next, let's talk about calcium and magnesium deficiency. Magnesium is called a soothing mineral, and this mineral helps prepare for the fight or flight response associated with the stressful situations. Cortisol, you've heard about this a lot, right? And this stress hormone depletes magnesium levels in your body. Thus, people who feel stressed and overworked are more susceptible to panic attacks. Typically, modern people living in the modern society these days are faced with situations in which they have no choice but to optimize their stress level so that they can actually cope with this a lot of stresses that they are facing these days. Therefore, if you're feeling lots of stresses, consider eating more magnesium-rich foods such as green leafy vegetables, for example, kale, spinach, or whole grains such as oats and buckwheat. They are really good sources of magnesium. For reference, calcium and magnesium should be consumed in 2-to-1 ratio, so that calcium and magnesium can be absorbed in our body very efficiently. Ninth, let's find out about iron deficiency. Blood tests of patients with panic disorder and hyperventilations were confirmed that those people had iron deficiency. And as a result, it was confirmed that these patients were not only deficient in iron, but also in vitamin B6. We talked about vitamin B6 previously. So therefore, patients who are suffering from panic disorder should take additional iron. If you think that you are deficient with iron, then you can take a look at those foods such as lobster, pork, anchovies, uh, garlic, wasabi. However, iron by itself is very difficult to be absorbed in your body. So what do? Iron is best absorbed when you are taking with vitamin C. So take a mind about that. So let's learn how to treat stress panic disorder. Panic disorder is largely divided into drug therapy and cognitive behavior therapy, or so-called CBT. Medication is treated with antidepressants and anti-anxiety drugs. It is usually maintained with medication for 8 to 12 months, and it can be effective for antidepressants, and they are long-lasting. Also, they can help with preventing panic attacks. The advantage of antidepressants is that they are not addictive to the drug itself. Anti-anxiety drugs are effective in reducing anxiety very quickly. However, the disadvantage is that the therapeutic effect only lasts for a short time. So I've mentioned about CBT, or cognitive behavior therapy, is a treatment to identify and correct wrong thoughts and behaviors by the guidance with a teacher who treats with you. And usually, the group cognitive therapy is used. Cognitive behavior therapy includes muscle relaxation and breathing techniques. So, in today's Facebook Live, the take-home message for you is that panic disorder is a disease that can happen to anyone. In the past, it was thought that this is a disease that can be happen to only celebrities that we know of. But now it is no longer is a disease for celebrities only. It can also even get young children as well. So in order to prevent panic disorder, it is important to create an environment that is stress-free. In addition, it is recommended that you continue to exercise very regularly so that you can cope with your stress. So let's just start by simply going outside and take a walk. Uh, so let me know, if you are, feeling stressed, and then if you're taking a walk, if it works for you, I guess it will be really nice. So also try not to be picky eaters, right? And try to eat various foods that contain lots of good nutrients. If you're always stressed out, why not just buy a commercially available stress ball and use it often so that you can cope with your stress. So that's all. So let's see if you have any questions or any comments. Okay, so eating increased food increases serotonin and cause panic attacks. Okay, can cigarettes cause panic attacks? I haven't really take a look at whether cigarettes can take a panic attacks, but I'm not really sure. Maybe there should be a link, but I haven't really taken a look at it yet. Yes, certain types of caffeine cause panic attacks in me. Okay, yeah. So if it happens, maybe you should, stay away from those caffeine so that, you can actually avoid having upcoming panic attacks. How lack of sleep affects to our productivity. Oh man, okay, we can talk about this for a whole day, but um, I think I've covered this like previously, but like while we are asleep, um, there is a cleaning system um, in the glymphatic system. So if you're not having a sleep well, very qualitative and quality sleep, then your body is not going through the cleansing system while you're sleeping. So it will actually, you can build up those waste uh, even after you wake up. So you don't feel, refreshed. You don't feel good, even if you, had a lot of sleep hours. So I recommend you to try to have a really good sleep, you know, but so some of the tips, try to exercise regularly so that you can fall asleep maybe easily, and also not try to look at the screens or take a look at the phones or your PC or smartphones right before you go to sleep, because those lights, like blue lights, can actually prevent you to or uh, can make you to fall asleep very difficult. How do you know if you're B12 deficient? Okay, so that's a very good question. You can just go, have your blood draw in the hospital so that you will know whether you're B12 deficient or not. So changing your diet will not change your anxiety disorder and negate the need for meds. Well, actually, um, no, I said if you change your diet, it will help you definitely. So, you know, try to think about. So, okay, here's a tip. If you try to eat the food that are not produced from the mart, or if you try to eat the food that are organically grown, that's the type of food that I'd like you to recommend to eat so that you can have better nutrition. Um, some of the guidelines tell us that you should have about 5 uh, full dishes of vegetables and fruits every day. So that way you can actually have a lot of vitamins and minerals that you need. Um, we often think about that vitamins and minerals are not necessary, but these days, on top of the three nutrients that we are taking, such as carbohydrates, proteins, and lipids, we need minerals and vitamins so that those vitamins and minerals can actually burn those three nutrients that I talked about, and that they help you uh, to absorb your nutrition much efficiently. So I guess this is it. Um, if you have any questions, feel free to just contact me directly. So I hope you guys having a really wonderful day. Um, it's 9:20 p.m. here in Korea, so I think this was really useful. Thank you, Flora. It's really good to have you two here too, and thank you, Abdul, and thank you, Paula. So I'll see you guys next time. Bye bye.